So remember, diagnosis of obstructive sleep apnea, OSA, is the exclusive preserve of a consultant respiratory physician. We're talking about diagnosis. But, and here's the best bit, in the UK, sleep-trained dentists utilising the BSDSM protocol, that's the British Society of Dental Sleep Medicine's pre-treatment screening protocol, can screen and recognise those that require further investigation and initiate MRD therapy for snorers without prior medical diagnosis. So let's turn that to positive. It means you can screen a patient and provide an anti-snoring device if you're happy that they don't need to go to have a sleep study. They don't need to see their GP, don't need to be referred to hospital. You can go right ahead and provide an anti-snoring device. Super. You can even, but we're not going to cover that in this course, you can even optionally perform home sleep testing. So for those patients that you think are mild to moderate symptomatic, these patients, if you wish, you can get some ambulatory monitoring, some home sleep testing kit, and you can actually objectively assess them, provide a mandibular repositioning device, and then retest them. And you can repeat this cycle of titration testing until you get them effectively treated with an MRD objectively, and you can actually see what's going on. And you can do that in an indemnified way. Now, I'm not encouraging you to do that because there's a cost involved in it. Little caveat on there, if you're providing MRD for a moderate OSA patient and they do not improve, this is the point, it should be obvious that you refer them to their GP. So let's come back to what we're doing in this course. Reiterate, as a sleep-trained dentist, using the protocol, you can screen and recognize those you can't treat and those you can, and then go right ahead and provide an anti-snoring device without a medical diagnosis. This is a unique situation in the UK. Final point to add, if you've received a referral of a diagnosed OSA patient, perhaps they have severe OSA, but they cannot tolerate positive airway pressure therapy, PAP therapy, and they need treatment, and the physician's desperate and he's worried about them, he may refer them to you, and he would be asking you to provide a mandibular repositioning device. Now you are okay. This is a double prescription situation. They've been assessed, they've been diagnosed, they've been prescribed, shall we say, a mandibular repositioning device. But the second prescription is for you to determine what is the most appropriate MRD for them to have.